the ear and the eye assessment. My name is Julius. I'll be a student nurse practitioner today.
Okay.
Gonna get some hand sanitizer, hand hygiene. We'll start with the ear test.
Okay.
So, I hope I'm not drawing a blank here. The ear is a sensory organ, and I'll be assessing cranial nerve 8. The auditory nerve. We'll just go into it. We'll start with the whisper test. I'm going to whisper a word about 2 feet behind you.
Okay.
Just tell me what you hear.
Okay.
You suck.
You suck.
Okay, she heard her hearing is working. And I'll whisper a word in the other ear.
You still suck.
Okay, so she, if there were any discrepancies in the whisper test, we'll move on to the Weber test, which is we'll use our tuning fork, and which one is it?
The little one.
This one?
Mm-hmm.
Okay. So we'll be checking that for lateralization of sound. So I'm just gonna explain the procedure. I'll strike the tuning fork. I'll put it in the middle of your head, somewhere in midline, and then let me know if you hear it.
Okay. Yes, I hear it in both ears.
Okay. So that's a negative Weber sign, and then I'm gonna move on to the rhyme test. But before I do that, I'm going to check just to make sure that the ear is symmetrical with the external canthus of the eye by the helix, and which it is. And then, so now I'm going to I'll explain the rhyme test to you. I'll strike the tuning fork.
Okay.
And I'm going to put it on the mastoid process, and then we'll just listen to hear if you hear it. Let me know when you hear it, when you stop hearing it, and then I'll move it to the air. And let me know when you hear it and when you stop hearing it. There should be a 2-to-1 ratio for air to bone conduction. So I'll just proceed. Let me just find the bone.
Yes.
Okay, let me know when to stop.
Now? Yes. Now?
Okay. So that's done. So, and that's a 2-to-1 conduction. So now I'm gonna just inspect the ear. I'm gonna inspect the pinna, the helix, the antihelix, and the lobe. And I'm gonna, she has some piercings that I can see. I'm gonna push on the tragus and for any tenderness. And does it feel tender?
Nope.
And I'm gonna push on the mastoid process. Does that feel tender?
Nope.
What about when I pull on your lobe?
No.
And then pull on your pinna? Is
Nope.
that tender? No? Okay. So there's no signs of infection. So now I'm gonna look inside your ear. Is that okay?
Yes.
I think the other one.
You want
I can try to use this one too, I guess. Just okay. This still trying to get the handle of it, but I can hold on to it, I guess. So I'm just gonna look. Okay, I'm gonna position, brace, and look. So I'm positioning the ear for the adults. It's up and back, and I'm gonna brace my hand on her face, and I'm gonna just look just past the tragus a little bit and see what I can see. So it looks. I can see there is some hair. There's a little bit of yellow curmin, and it looks, I can see the color is pink, and just looking past the I can see the tympanic membrane, which the tympanic membrane, it has the what is it, the uvula and the handle of malice? No, that's the eye. Anyway, the tympanic membrane, it doesn't, there's, I want to say there's no signs of infection for like a normal, I think yours looked a little cloudy, but the tympanic membrane is pearly gray and should be pearly gray and glistening, and there's no signs of edema or should be any signs of edema or redness. She's actually recovering from an ear infection, so hers looks a little different, and it looks a little cloudy. They're still grayish, and it looks, there's a little fluid in there. And so, but that concludes the ear inspection, and then I think we'll move on to the eye inspection. And so for the eye inspection, is that okay if I do the inspection? For the eye inspection, there should be, the patient would have already done the assessment or the evaluation with the Snelling chart before coming in the room. So we'll start with the eye assessment of optic nerve 2. So we'll just start with the inspection of the eye, and I'll look at the lids, the lower lids, the cornea, the iris, lens, the pupils, and the sclera. The lids look symmetrical. The lower lids are, I'm pulling down on the lower lids to look at the bulbar conjunctiva and the membranes in there. The sclera, both sclera is white. Her eyes look normal. All those, there's no abnormalities noted. So I'm gonna, I think it's the corneal light reflex after that. Hope I'm not missing something. I keep saying that. So for the corneal light reflex, oh, I did miss something. I'm supposed to check to make sure the external canthus of the eye is aligned with the helix of the ear, and which it is, so that's normal. So I'm gonna check. Turn this on. Is this? Oh, so this is the side with the light. Sorry. There we go. And then there's this light. Should be at 0, right? Okay, that's 0. Okay, we'll just go with it. The corneal light reflex, I'm gonna shine the light into both of her eyes, and I'm gonna look to see that both her eyes dilate at the same time, and I'm gonna look for the reflection of the light in her missed the confrontational visual focus into both her eyes. That's gonna access cranial nerve 2 and 3. Cranial nerve 3 is the oculomotor nerve. So I'm just going to shine that light right there. Okay, they both constrict at the same time, and the light is reflecting in the same spot symmetrically in both of her eyes. And then, so now I'm going to do the confrontational visual fields test. That is, that's going to assess cranial nerve number 2.
Okay.
I'm just going to put my hands in like your visual fields,
okay,
and I'm going to wiggle my fingers. Let me know if you see them.
Yes. Yep.
Here, and then here?
Yes.
Okay, that's fine. So that concludes that part, and the next part is the direct and indirect consensual light, and that is gonna That's cranial nerve number 3. And I'm gonna look for, when I shine the light on one side one eye, the other eye should constrict at the same time. So I'm just gonna move in over here. So this is direct. The light that the eye is in is direct. The other eye is indirect. And I'm gonna shine this light into the left eye, the right eye, and just make sure it does the same thing on the other side, in which it does. So that's symmetrical. And I'm gonna check for like I missed the red light, but I'll do that later. So let's do the pupillary accommodation and the cover and uncover. So the cover and uncover, that's gonna check. That's for cranial nerve 3. That's to evaluate for any esotopia or exotopia. I'm just gonna cover your eye, and then I'm gonna move my hand over and see if there's any leg drift or what was it again? Any drift or lid lag or drift, and then I'm gonna do the same thing on the other side. Okay, there's no lid lag or drifting noted, and then I'm gonna do the pupillary accommodation. So how this is gonna work is I'll put my finger directly in front of your face.
Okay.
You're gonna stare at it, and your pupil should constrict. And then I'll have you stare at a spot directly on the wall.
Okay.
Pick a spot on the wall, stare at it, and they should dilate.
Okay.
So I'm just gonna put my finger right here, okay, and then just pick a spot. And they did dilate. Okay, so that's the pupillary accommodations. That assesses cranial nerve 3 as well. And I'm gonna check for your eye muscle movements. That's also cranial nerve number 3. This is the eye muscle movements. It's to check to make sure there isn't any lateral nystagmus. So I'm gonna just move my fingers in different directions. I want you to follow my finger.
Okay.
Okay, so there wasn't any twitching or anything like that noticed. So now I'm just gonna look at the inside your eye.
Okay.
At the so I think I'm gonna do maybe I'll start with the red light test, and then to see if there is any, like, there should be like an orange or reddish. The lens should look orange or reddish, and once they both look like that symmetrically, that means her lens is normal. And then I'm going to move on to look at the internal location of the eye structures. So I'll just start, let me just see, I'll start with this eye. Okay, I do see the reddish. I'm just going to move in. You can see the optic nerves. I can see the optic disc. The fundus is visible. Okay, I'm just going to move on to the other eye. Okay, I do see the red light. I can see the optic nerve, the optic disc, and the fundus is visible in that eye as well. So I think that concludes the eye and the ear exam. You think I missed anything? Help me out. Just whisper it. I don't think I missed anything, but that's fine. If I did, I'll lose a point, whatever. Thank you
Yes,
for
thank
your
you.
time.